You may be a fresher writing FMGE for the first time, or this might be your first, second, or third, or fourth attempt. You might have prepared from online sources, or you might have attended offline classes. You might have started 1 month back, you might have started 6 months back, or you might have been preparing for even more than a year. Whatever category you fall into, there are some things which you have to do correctly on Jan 12th, which will help you to cross the 150 mark. Whereas, however good your preparation might have been, if you do some things wrong on Jan 12th, you might find yourself falling short of 150. Hello guys, I am Dr. Ram Gopal, a full-time ophthalmologist and author of Sure Success Magic, the lifesaver book for FMGE, NEET PG and INI-CET exams. I want you to watch this video to the end, follow some of these basic principles and give yourself a good chance of passing the exam, and you can thank me later. Beware of the rocky road. What do I mean by this? Look at this road filled with potholes. Do you think you can drive fast on this road? No. In your FMG exam, you have to cover 300, that is 300 questions, or you could equate it to 300 kilometers. But do you think this kind of road will last forever? If you have ever driven, you know. You will go slowly on this road, but you will not get depressed that the road is like this. Yes, certainly you'll curse the system that the road is like this. But then after 5 or 10 kilometers, you realize that you come across this kind of road. You just step on the accelerator and you go to your destination smoothly. So this is something which you have to be aware of. The rocky road or the rough patch, what I call, there can be a set of 5 or 10 questions which will make you feel, oh, the exam is very tough this time. Oh my God, I'm not able to answer even one question. One became wrong. Two, three, four. I don't know anything of these 10 questions. Imagine if you get this set of 10 questions at the beginning of your exam. You will feel, oh, exam is very tough, man, this time. Okay, I'll prepare for 6 months later. Boss, after the 10 questions, you have 290 questions more. You just have to get 150 correct out of those. Definitely possible, yes. Now, let us see if you hit this rocky road or the rough patch at the end of your first session. You have finished 140, then the next 10 questions are very tough. You already you're low on confidence because your first session is not going so well. At the end of the first session, you get this really bad patch and you feel, okay, first session gaya haath se. No, everything is gone and your state of mind is not at all good for the next session. No, that should not happen. Imagine if this comes at the beginning of your second session. Again, same problem. First session was not so good. Second session starting is not good. You rule yourself out, saying, oh, this exam is gone. Not at all. See, there will always be about 10, 15 or 20 questions which will be very difficult. These might come together, or these might be split into a set of 5 or 5 questions, 10 questions, again 5 questions, again 5 questions, which may be difficult. So you should be prepared that you will encounter this kind of rough patch or rocky road sometime during the course of your exam. But don't panic. This is bound to happen to each and every one of you. Just negotiate. That means be careful when you cross that road. Then go, once you come onto the smooth road, just go on with your journey. Everyone makes silly mistakes, but the toppers or people who pass make lesser number of silly mistakes. Always focus on the MCQ on screen. Okay, let your concentration be there. Don't be worried about the previous 2 or 3 questions, whether your answer was correct, whether your guess will turn out to be correct. Maybe if I'm lucky, no. One question at a time for all 300 questions. Also remember, read the questions and options carefully. Everyone will tell you, starting from your father and mother in first standard, they will tell you. So look at the question. All are true, or which of the following is false? All are true except, is it superior surface or inferior surface, or have they given the anterior branch or the posterior branch? Just concentrate on the question. You will automatically avoid the silly mistakes. Don't overthink. Okay. Sometimes you look at the question. Aspect sign is seen in psoriasis. That is the answer. Now you will start thinking, is it lichen planus? No. Is it pemphigus vulgaris? No. Or you see an image of simple acne or pimples, acne vulgaris. Options you saw very straightforward. Now you are thinking, Could it be any other condition? Could it be bullous simpatico? Why do you want to do that? Why do you want to torture yourself? No. No overthinking. Simple question, simple straightforward answer. Like I said, caution is good, but don't think of extra precaution. Always read the question, think in your mind, you got the answer. Yes, look at the options you have marked, move on. That is why I say 1 minute per MCQ is enough, or sometimes more than enough. For example, lateral rectus muscle is supplied by which abducens nerve or sixth cranial nerve. You know the answer, look at the options, mark it, and go on. That question will take you about maybe 30 seconds. Even if it is given in a long stem or a long clinical type question, it will still take you 30 to 40 seconds. That is why I say 1 minute is usually more than enough. And avoid overconfidence. This is something which you should know. Oh, you saw the question, then you think, oh, it is such an easy question. What, these people are dumb enough to give me such an easy question, such a cheap question. You go and mark the wrong answer. And then you will torture yourself after the exam thinking, oh, I made a silly mistake. So let me put what all I just told you into an example. Example of a silly mistake and how to avoid it. Look at the question. Patient had a tennis ball injury to the eye and he came to your clinic. On examination, you saw a osseous ring. So osseous ring is seen on anterior surface of the cornea, posterior surface of the lens, anterior surface of the lens, posterior surface of the cornea. Okay, even if you read this slowly, it will take about 25 to 30 seconds for you to read this question. Then just think in your mind for a moment. This is a common question. What's your string? You know. It is seen on the anterior surface of lens. Now see clearly. Now don't be overconfident and mark option number A, which is not the correct answer. It is not on the anterior surface of cornea. It is rather on the anterior surface of the lens. So if you are overconfident, you are likely to make a mistake over here. If you overread, you will be wasting time. So already in your mind, you know it is on the anterior surface of lens. So look at the option over here and mark as anterior surface of lens. So that is how you avoid the silly mistake. See, we all know that surgery, medicine, PSM, OBG have the highest number of questions as per the question distribution given in your bulletin. Now, there are many other subjects wherein you feel the number of questions are exceeding more than what they had mentioned. See, the line between subjects is very blurred. If I give you an example of iron deficiency anemia, is it a question from hematology, that is pathology? Is it a question from biochemistry with regards to hemoglobin? Is it a question from medicine? Or is it a question from pediatrics? Or if you put in the word pregnant woman, then it becomes a question from OBG. So iron deficiency anemia can be a question from many subjects. Similarly, if you see this example over here, restriction of abduction. Now, is it anatomy question asking which nerve or which muscle is involved, or is it an ophthalmology question, or is it a neurology question? Similarly, throbbing headache in a 75-year-old man, example here, with sudden loss of vision, bulging, throbbing superficial temporal artery, classic example of temporal arteritis. Is it a medicine neurology question, or is it a ophthalmology question? So that way the lines become very blurred. So when you encounter some or many questions from a particular subject, don't get very worried saying, oh, I hadn't read this subject, many questions are coming. See, the overall question distribution will generally be followed, but because of the overlap, we may feel one question has more, or rather one subject has more number of questions. So don't let that really cause any panic there. So if a question is very long, don't get scared by the length of the question, or if there is some image which has been shown which you have never seen before, don't get scared by the image. Generally the question will have some keywords inside. Just the example which I gave you now. They can give 80-year-old man with severe throbbing headache came, and you could see that he had a dilated blood vessel on the temporal aspect, and they can give you a question image of the temporal artery biopsy image. Now this temporal artery biopsy image you have never seen probably. Example of vasculitis. So they'll ask you the diagnosis. So there you can say that based on the history itself, without even seeing the image anytime, you can say that this is temporal arteritis. So that is just an example what I gave you. You could have any question. So questions may be very long, questions may be very short, but then don't get Worried if it is a very small question saying, oh, no one-liners are coming, they gave so many one-liners. Good that if they gave you one-liners, your job is easier. Oh, too many long questions, still 1 minute will be enough. You will know the text within the question, or sometimes you'll know the image. If you don't know either, then probably it is a alien question which has been asked for the first time. Don't worry, if it is alien to you, it is alien to everyone. I have told this time and again to hundreds of FMG aspirants who keep messaging me. Don't defeat yourself in the lunch break. You have part 1, you have part 2. See, part 1 plus part 2 equals 150 plus you have to get. Not only in part 1 or not only in part 2. If one part was bad, then you feel during lunch break, oh, this is very bad, man, I will get very less in part 1. Put yourself under pressure for part 2. See, part 1 is equally important. You have to try to get maximum corrects in part 1. Part 2 is equally important. Try to get maximum corrects in part 2. So in that break between the two parts, you will remember some questions, look at the book or look at the phone and say, oh, this became wrong, that became wrong. In the break, ideally, have your food. If you really feel reading something will help you read, otherwise just relax, go back and write the exam. It will not make too much of a difference rather. And again, now the exam is divided into segments, 3 segments in part 1, 3 segments in part 2. Just like I said, part 1 does not fail you, one segment does not fail you. You have to look at the bigger picture, overall picture. Like they say, what is that saying? Don't forget the forest for the trees. Don't keep looking at the individual tree and forget the whole forest over there. See, one of the major positives of the FMG exam is that there is no negative marking. Quite a paradox statement. Na? One of the major positive of this exam is that there is no negative marking. So it works in your advantage. There are some questions wherein you may not know the answer at all or you may not know the exact answer, but I want you to take an educated or a calculated guess. Don't just look at the fan, look at the AC or look at some teacher's face over there and mark the answer. Don't do that. What do I mean by educated guess? There are 4 options, 2 are not the answer, so only 2 are remaining, means 50% chance if you guess. So that is the kind of guess I want you to take. Just because question was new, don't mark A, B or C or D. Just look at the options, eliminate or rule out and then give the calculated guess. What do you call it? What do you call it in Hindi? तुक्के मारना ना. So अगर तुक्के मारने ही है तो थोड़ा सोच समझ के तुक्के मारो. I know it is easy for me to give you all this gyan or muft ka gyan or advice. But what I want to tell you is don't over stress, if I could give a summary of this whole video, that is follow these few basic principles and don't over stress, it is okay to be anxious, everyone. If you give me an example right now, even I'll be anxious, anyone for that matter. So for 1 or 2 days or as the exam is approaching, you will feel there is so much left to study, so little time. All these are common. It is universal, happens to you, happens to the topper also. But don't become hyper anxious. I had a junior just before the MBBS university exam. He used to have epigastric pain. He used to vomit out. He used to vomit out blood sometimes. Yeah, don't take it so crucially or so critically. Don't make it a matter of so much criticality. Yes, the exam is definitely important. It will get you over the line. Get on with your lives. Otherwise you have to wait another 6 months or 8 months. I understand that, you understand that, but maintaining your calmness, the title of this video is keep calm. Okay, maintain your calmness just a few days before the exam and actually when writing the exam is very important. That itself can sometimes take you from the 140s to 150 plus. Yes, so that is something which you should bear in mind. Don't become over anxious. See, you will come across various other stages in your career. See, all of you will become doctors, you will finish your MBBS, many of you will go on to do your PG, you will be faced with so many more challenges in your professional life. And let me tell you, you will overcome that in a like this, chutki marne se you will overcome all this because you will get so used to handling. So it will not be stress anymore, it will be your job, it will be your work. So your work involves a certain amount of, I will not call it stress, but a certain amount of decision making at certain crucial times, which you will learn to handle and you're all destined to become great. Okay, it is just that you are stuck at this phase now and you will soon get over this and get on with your life. So hope these few tips helped, guys. So study well till the exam. My next video I'll probably posting only after Jan 12th. So study well, be kind to yourselves. All the best.